Hey, everybody, welcome back to the Particle Accelerator podcast, where we talk to future thinking business leaders about how to accelerate their business and grow their team. I'm here with Randi Deckard. Randi, would you introduce yourself, please?
Yeah, so thank you so much for having me on, Benjamin. My name is Randi Deckard, and I'm currently the Senior Vice President of Client Engagement at Besler. I oversee sales, marketing, customer success, and we're in the healthcare finance space. And in my spare time, I'm a CRO advisor for digital health startups. And the one that I'm most excited about right now is Heart Health Community.
Oh, yeah. What does Heart Health Community do?
So it's a digital platform that is complimentary for patients, family, loved ones. If you see a doctor, whether it's in an inpatient setting or just an outpatient setting, and you have some type of heart disease or prognosis, you get a QR code upon discharge. So when you get your discharge papers, and that is curated education for the patient. So that's everything about the disease, as well as diet, nutrition, physical therapy, you name it. And so they're using AI and ML, machine learning, to deliver that curated experience to the patient. And it's just something I'm super passionate about. Is number one, almost everyone in the United States has a phone. So, from a social equity and accessibility perspective, that removes some barriers because it's an app on a patient's phone. Almost everyone has a phone where they can carry that information, which I think is phenomenal, especially like in rural areas where, um, you know, you know, they may see a specialist in a big city, but trying to get additional information is hard. That's just one way that they can make healthcare more accessible and, like I said, socially equitable as well.
Yeah, that's great. I've worked with a client, built out a platform. They're really concerned about the post-care, in cancer treatment, obviously continuing with the
Mhm.
treatment since it's rather uncomfortable, needs a lot of help. How do you handle some of the side effects? Even folks that are on Ozempic or Wegovy doing, there's some side effects there, and often that's kind of missed from the doc. And so I can see how bringing the content and an AI led experience to help walk people through the treatment so that they continue it. Like they came in for a reason, or they're trying to address a particular ailment, but they kind of have to see the treatment through. And so I can understand how valuable that might be.
Yeah, and I love your share of the cancer. I used to work in the oncology space, and Texas Oncology and U.S. Oncology were two of my biggest clients. And I know that's one of the things that the case management nurses talked a lot about is, the folks who did better had support, but having something like this, like an additional digital support when they go home, I think is super critical. Great. I love that you participated in that.
Yeah, cool. Well, the way I'd love to get to know you, I ask all my guests this because it's just great to hear where people have come from, to rise
Hmm.
to the levels of success that they have today. So, how did you make your first dollar? Like, what was your first job? For me, it was a paper route. Um, I've said that on every episode, but how did you make your first dollar?
So mine is not as glamorous as yours. I'm a farm girl, and so my nickname Benjamin was either Pooper Scooper or Ram Poop because I hauled manure. That's literally was my side hustle, and that's actually why I got an education because I didn't want to have to haul manure anymore.
Yeah, yeah, we've had some fantastic Agriland graduates
Yep.
on this podcast. Some other farm girls. One was a CTO of a really forward-thinking company in VR. So yeah, love it. Yeah, I mean,
That's where I got my work ethic, though, right? Like I have a great work ethic because of the farm, because you're early up and like there's you just have to do stuff, right? But yeah, that's why I got education.
That's awesome. Well, what toy or hobby did you have as a child that inspired what you do career-wise today?
Oh my gosh. This is going to sound really horrible. I ended up accidentally in the commercial side of healthcare. I originally was clinical and actually wanted to be a forensic pathologist. So I actually had like a microscope kit when I was, young and was always, putting things under the microscope. And then, some people may find this a little bit harsh. And so if you're a vegan, stop listening for a minute. We used to butcher too. And so like literally I would be the person dissecting the eyeball, because I was just curious. So I would say that curiosity from that aspect is really what helps me be really good at what I do. Because I think in business, being curious and always wanting to learn and improve are just, it's part of my nature. But really, what's a microscope?
Yeah, I think my mom found a jar with like a turkey heart or something in my closet because I was just so fascinated with like the giblets bag from a really big
Yes.
turkey we had gotten one year. Yeah,
Yep.
but I think that's a lot better than getting inspired for surgery by doing the game Operation, right? Like uh,
Right.
having a microscope is really cool. Awesome. Well, what was your favorite and least favorite course in school?
So, when I was in university, y- I was pretty much all, science, so like clinical chemistry, biology, physics. I actually had to take an English course and I hated it. But you have to I had to take it because doing research, you have to be able to write, right? So, and obviously communication is super important, but my science brain really struggled with like the writing. And what I actually loved the most, which may surprise you, is that I had to take a language class. So I went to university in Canada, and at the time, if Canada's bilingual, the second language can be French. So I took Norwegian, and my professor was just amazing. And I absolutely loved it. In fact, I backpacked in Europe for a year after I graduated and spent time in Scandinavia just because I fell in love with the language and culture.
Yeah, that's really cool. One of my guests who when this podcast airs, it'll be last week, the previous week's episode. He into sales and he loved language, just language,
Mhm.
just the expression and communication. It does unlock communication to understand that words have meaning, but only to the people who are hearing them.
Mhm.
And so like that, understanding that makes people very phenomenal communicators.
100%. And I love languages and I'm a little bit of a nerd. We lived in Maastricht in the Netherlands for a bit, so I picked up Dutch. And because of my dad was in offshore oil for a little bit of Lebanese, Arabic. So I just, like I said, I love language and, obviously the culture that goes with it. But once you get an ear, I think it's easier to pick up things. But I do think it's funny where I live in Dallas and I don't speak Spanish, um, which is pretty sad, but true.
Yeah, love it. Love it. Well, what quote from a famous person lives in your mind rent free?
Mm, I don't know if I don't believe it's from a person, but it's an African proverb, and it's like if you want to go alone, or if you want to be alone, you'll rise to the top. But if you want to go further or go faster, be together. And I always think about that because when you're a leader of a team, having a diverse group and the people you hire make such a difference. And so that's always my reminder is that alone, there's certain things that yes, I could do faster just if I did it by myself. But if you actually want to go further, you need a whole diverse team because you're shortcutting. You don't know what you don't know. Other people have creative ideas, experiences, et cetera, and that's what you miss out on.
Yeah. My last venture, the tech team that I put together, um, was one of the most diverse teams I had ever had. And we were very high performant when it came to professional, but we could not choose a place to go to dinner or have a happy hour. We had from the Muslim to the Mormon and everything in between. And so, yeah, having out of work events was super challenging because it just, it was really hard to find something that everybody would agree with. We had people that didn't drink, we had people that did, we had just a plethora of diet restrictions and different tastes. And so, yeah, social events very challenging, but work life was awesome.
I love that you shared that. I was at a company a few years ago that we had a very diverse team as well because we're a global organization. And one of the things that we did, because we had this space, so we do like potluck happy hours. And so everyone would bring something, a dish, and, including, their favorite beverage. Some of it was non-alcoholic, but there's just something about bringing people together around food. And when someone shared, whether it's, you know, their aunt or their grandmother's, recipe, and they share that story, I think everyone was willing to try things like more because of the stories. And that was just one way that we bonded because I get what you're saying to actually physically go to a restaurant or challenge. But that's one of the things that we did just because there was such a variety of people. So um, it can be
Yeah,
done.
love it. Yeah, love it. I mean, to connect with my neighbors and even the neighborhood I live, I would be better off like having biryani night than I would
Yeah,
be, trying to do something else, right? So, totally.
right.
I love the way the world is homogenizing and that we get to experience these different cultures. Well, I'll move on to some of the kind of more innovation oriented questions or business oriented questions. It's been great to get to know you. What tech trend significantly impacted your industry and how did your company respond?
Yeah, so in health, I'm in the healthcare industry, and I would say first off, healthcare is a bit laggard with AI and innovation because it's so heavily, regulated. And, this year, a cybersecurity really hit the healthcare industry hard. There was the um, um, Change Healthcare event. There was also the CrowdStrike event where, hospitals can, operate and just our clients alone, that is just one thing that has really impacted us. So that may not be the answer you're expecting, but for us, that diligence on cybersecurity has really impacted how we think about what we're going to do. So, even when I'm talking to my customers and how they're thinking about how they're going to use AI, and they're like, the first step is a governance committee because if we have these challenges with cybersecurity without AI, that opens up another layer, and we have to have our governance committee set first before we start looking, across the board. But in our industry, I would say, AI and specifically like clinical scribe is like was the most easiest thing to turn on. But cybersecurity is really, I think, slowed things down a bit. It's something I'm really bullish on as AI, but I know that I just have to be a bit patient because of the governance and the regulation, and for good reason, right? No one
Right.
wants their information out in the Ethernet to be used for whatever reason.
Yeah. That brings up a lot of great points. The I might be going a little off-roading here with the cybersecurity. So one of the services that my company provides is this idea of cloud automation. And what I mean is that used to be system administrators or some tech guys would go
Mhm.
configure servers to run systems, and then the business would build their, have their software platforms on top of those systems. And over time, we started to want to do that better. So we started writing code to represent those servers and to configure them automatically so that if something like the CrowdStrike incident happened, we just destroy them, recreate them. Nobody has to go log in or
Mm-hmm.
and so what you found was people who had adopted the cloud automation kind of DevOps technology, they recovered very quickly. The people who did not, that had to find a way to log into the server and make the change or reboot it, or those folks took a long time. Um,
Yeah, I think that's a really great point. One of the things I was at DHIS, so it's a Digital Health Innovation Summit in Park City a few months ago, and there was a panel that ended up going way over, but we all like agreed like this is such a great conversation. It was around business continuity and resiliency, and so I know some hospitals and even ourselves, like we have like backup or redundancy plans in place, and what you're saying makes complete sense. But for some folks, whether I think like the backup redundancy plans are sometimes a cost issue. So I really like what you brought up from a business continuity perspective, because it's not as costly to having something completely set up in another server ready to go.
yeah, yeah, and then yeah, totally agree. Yeah, sometimes the duplicity of redundancy is
Mm-hmm.
not cost effective. So the approach that we've been seeing is if your time to recovery was super quick, then you don't need
Mm-hmm.
redundancy, you have resilience. And so that's what DevOps, the kind of the DevOps movement has really given people the opportunity to think about, is that if everything is repeatable, then you're resilient. You don't need to be redundant. And yeah, sure, there's a cost to do it right. Um, but what we've kind of taken on is this approach that, well, don't do it the wrong way. Don't do it the unrepeatable way. Don't have people with hands on keyboard use these, codify that so that it's highly repeatable, and then you get resiliency. You don't have to worry about the duplicate costs. So, yeah, just that touched for me when you talk about CrowdStrike. We had clients that had made that investment in resilient architecture, and they pushed some buttons and were back online. While the ones that were kind of still in the old IT world were really struggling. Um, and then you also mentioned this desire to do HIPAA, and machine learning and AI really needed to be on anonymized data sets. And I love
Mm-hmm.
that because we're starting to see the data modeling engines already anonymized. So from the raw data, the trace back to the raw data is not possible. And we're seeing technologies that are allowing people to transfer the matrix, if you will, around the data set, the statistical relevant information around the data set without the personally identifiable information. And this is
Yeah.
accelerating the machine learning that has not hit healthcare yet, but it is about to, and it's going to be big when it does.
Yeah, so it's interesting. So in the DFW Metroplex, there's a AI group, and there are a couple companies who like startups that they're, and one of them is Protecto, that I can think off the name of my head, that they started off with anonymizing data. It wasn't just for healthcare; it was for anyone who was looking at large data sets. Um, and I think the biggest thing, just being in healthcare, and data is knowledge. Any industry, data is knowledge, data is power, and the machine learning that can be applied to it, and so you can actually get something meaningful from the data set. You have all this data, then what do you do with it? I think this is an exciting era, and I just wrote an article, AI in healthcare, for um, a magazine, and I was talking about all the applications, from precision medicine to research, et cetera, using these data sets, because I used to do clinical research. And so the amount of time that it takes like to bring a new drug to market, as an example, if you can shorten that cycle, that can also reduce the research and development costs, which means that the drug when it comes to market doesn't necessarily have to be as expensive. Now, big pharma may not like me saying this, but you know, from a profit perspective, but I don't think I think that's those are the kinds of things that I get really excited about for healthcare. Is how can we make it more accessible, more affordable? How do we take a bite out of the cost of healthcare? And so things like that, just like I think are super exciting.
Yeah. I think if Big Pharma loses and we all win, then they'll just have to take one for the team.
Yeah.
But on the lines of what you're saying, yeah, typically we're seeing these data, like companies have data silos, and then
Mm-hmm.
they're anonymizing those data silos. At what point can we share like anonymized information that's relevant to problems,
Uh-huh.
um, rather than, I think data kind of gets hidden in the back room. And
Yeah.
I think it's about to see say, well, hey, how I've been working with this particular type of ISP, or I've been working with this particular
Uh,
type of problem. How can I now expose that data to be kind of available for the common good and make money doing that? That's super interesting to
yeah.
me.
I agree. And once again, going back to DHIS, like we talked about data sets, and I think the biggest thing in healthcare is also understanding, even if it's anonymized, what was behind the data set, so you don't have biases. There, have been some studies done where there was bias, and for example, they did not have any African American healthcare staff and you know things like that. I think we just have to be really careful about, like, so if you are either buying a data set or looking at a data set for machine learning, you need to really understand what's behind it, before it's been anonymized. Otherwise you might not get the outcomes that you want, or
Yeah,
like I said, you
totally
may be
agree.
biased and not realize it. Yeah.
Yeah. Well, what are some technology innovations that you're betting on to drive your business or your industry forward?
So it's not just AI. I'm looking at, just the last little bit, like the agents in AI, like I think that, once again, if I can just go back to the tenets in healthcare of making it accessible, affordable, um, and still, not impacting, patient outcomes, there is so much waste in healthcare. I don't know the last time that you had to book an appointment or get a referral, how many phone calls you might have had to make. Like there's agents now that are, it's using a combination of AI and workflow. So things like that can be seamless. And so it doesn't actually require a person, and, it can be managed, where you get a text as an example, you say, oh, I can't make it or whatever, and it automatically goes and gives you additional time based on what you said. That wasn't done by a human, right? So things like that are just like a small example of how there can be a bite out of healthcare. And like even in the heart health community that I was sharing with you, using the machine learning and only giving curated information that you need. So, someone isn't Googling whether, like, you're sharing about the oncology. What does this mean? And then they get all this stuff and then they're like, a wreck because Google has presented things that aren't really applicable, right? So I think that's super exciting about being able to give people this great experience, but it's really personalized to them.
Yeah, I love that. I find along those lines, the you I hope people are also considering the naturopath opinion. Then they have their general practice doctor, and then they have specialists. Those group never talk. And so it seems like there's something that can help or assist the patient in kind of giving the full story to all those different voices that they need to rely on to address their health. It's so isolated. The naturopath doesn't know what the urologist knows, doesn't know what the general practitioner goes, and then a lot of times we're self-prescribing. A lot of men my age are doing the TRT, so they go to a GP and they
Mm,
grab and go testosterone. And then the naturopath may know about that or may not, depends on if you shared with them. So they may be saying, well, you need to take DHA as a supplement. Well, now all of a sudden you're having a prostate issue and you're going to that particular specialist,
yeah.
and they're just not connecting the dots. And I think man, if there was an innovation that could help solve that, the patient profile that was owned by the patient and shareable to these different folks, I think that would be tremendous.
So I love that you brought this up. So I want to tease this out a little bit. There's a term in healthcare called interoperability that, when EMRs first came out, oh, we're going to have all this data and everyone's going to be able to see it and share it. Well, that hasn't happened. Now, it is still an initiative, but I just, because of regulations and the way systems are set up, I see it challenging. But having previously been in like the medical credentialing tech aspect of the world, you basically had a digital passport as a physician that had all your credentials. So what you're saying, if you could flip that as a patient, if you had a digital health passport that had everything that you could literally like, here's my phone, you're my Dr. Johnson, and I literally just tap and you get that's my way of sharing
Yeah,
my
QR code, here you
my
go. Yep.
right. Like, wouldn't that be so like you'd think it would be
It'd be
really
a dream.
simple.
Yeah,
It
it'd be a
would be a
dream. Yeah,
dream.
for
But
sure.
if I could start a company, I would create a digital health passport where you could literally just tap and share your information. So it would share, everything that you're on. And then you could even put taking vitamin D or whatever, because
Yeah.
we all take, over the counter. And sometimes you may not realize that there's things that conflict. And no matter who you see, whether it's a functional medicine doctor, naturopath, whatever, even though I'm clinically trained in Western medicine, there are other areas, and there's a huge movement for food as medicine that is starting to catch on. The US has been very popular and known for years in other countries, how important the gut biome is, but it's not quite mainstream in the US yet.
Yeah. Yeah, I feel like the EMR industry got super attacked by regulatory capture. This idea of, I think Epic was the
Uh,
forerunner, and then
uh-huh,
then regulation was created that, well, if you want to compete in the space, then you have to basically be like Epic. And
uh-huh.
it's interesting when you hear companies like big tech say, "Oh yeah, regulate us," right? Because then nobody will be able to compete. And
Yeah,
we definitely saw that in telecom. Like there are only 4 or 5 telecom companies where there were like 20, and because regulatory capture started to um, increase the barrier to entry. How do you see that? And I bet that's just kind of become part of healthcare, where this regulatory capture always seems to benefit the incumbent, like always seems to benefit the people who are already there. And then they get
yeah.
fat, and comfortable, happy, fat, and comfortable. And then innovation tends to slow. How do you
Well,
experience that?
yeah, so like I said, healthcare is laggard. And I think Epic's a great example. I actually had a post on this on LinkedIn a little bit ago because super excited. Oracle purchased Cerner. So I can't remember, but I want to say like Epic has like 50% of the market. Cerner is like 35, 40. But with this Oracle Cerner, Epic better watch out because they've been the main player for a long time. And then everyone else, it goes down to like 0.1%. And there's a lot of companies or a lot of EMR systems, like when I first started, MedTech, Greenway, Athena Health, they're still around to a certain extent, but like small percentage. And I think that, like even in the industry that I'm in, we're TurboTax for hospitals. So we help them get a bigger check. That's our software. We're innovating and disrupting. we're working with CMS. CMS hasn't had someone work with them for 35 years. No one's
Wow.
attempted it because it's a big elephant to take a bite out of, right? So
Sure.
our firm is doing that, but we're the first ones to work with CMS in 35 years on this particular software project. And there's only been for 35 years this one other company. So you know, I think that you have to have companies that either have the funds so they can be disruptive, and they have to have a really strong vision. And I'm also super excited about what Amazon is doing, just from a clinical perspective, and how they're looking at telehealth and everything else. I know it's not as exciting necessarily, um, technical digital, but it is still digital with the telehealth and what they're doing and trying to take a bite out of, um, the industry. So I think we just have to just keep pushing. And unfortunately, like healthcare costs in the US are the highest out of any, you know, um, first world nation. We spend more on healthcare than any other country, but we're the sickest. Why? We don't spend money on preventive medicine, and we have such high administrative burden. You talked about, incumbents. I mean, the payer. You look at United Healthcare and the profits that they post. How are they doing that, right? They have systems in place to, automate denial. Now, they they say that's not true, but you talk to any provider, it's like, how can I submit something and the denial comes back within like a minute? No one looked at that claim.
Right. Right. Yeah.
Yeah.
No, this definitely needs some help. I feel like I get more value as a startup entrepreneur guy. Um, I feel like unless you reduce the regulations in things that aren't life or death, like
Right.
um, of course I don't want somebody who doesn't know how to wash their hands walking into the operating room and handing
Right.
the prosthetic or the implant to the doctor,
Mm-hmm.
right? Like I get there needs to be regulation, but but regulation around the software that we're using, that seems like an overreach. And um and you, uh, you know you even see this with bigger companies, Sabre, who American Airlines, Sabre,
Mm-hmm.
that kind of thing. They had one of my good buddies, he worked at Sabre Labs, and Sabre Labs was this little pocket of testing within the larger
Mm-hmm.
company, kind of akin it to like the dinosaur was trying to raise a dragon, right? The
Right.
how do you have these like startup ecosystems within larger companies so innovation can occur? Because man, when you get a small team that can be fed by two pizzas and you give them a mission of creativity and you kind of unlock them, then like really magical things happen. um the same kinds of teams were happening in the larger organization, but larger organizations have these folks that, uh, like it or not, they kind of disrupt innovation. They're kind of like in the Matrix. They're those robots that go
Mm.
destroy stuff in the real world and prevent the magic
Right.
from happening in the Matrix, right? And so larger organizations have those folks that are more control oriented, and that's really counterproductive. Whereas startups don't have those people, and so that's why you see, the smaller company innovating and the larger company being stagnant. So, yeah, without the reduction of regulation, I think we'll have trouble getting to something that behaves more like Better Health. Better Health is an app that my naturopath uses. I report my nutrition in there, my
Mm-hmm.
macros. He can issue protocols in there. Like this is the
Mm-hmm.
relationship that I want with the healthcare industry, where yes, I'm responsible to give it data about my daily habits, put my workouts in there and
Mm.
everything, but then they can give me protocols and recommendations around things. And that's I don't know about others, but that's what I want from healthcare.
Yeah, and there are hospital systems that have commercial arms where they have like a innovation area. So like Intermountain, Mayo Clinic. Where I've seen innovation is, you know, it's more on like I said, precision medicine for cancer, oncologic, and like I said, I think that everyone, the patient experience you described and that relationship, because everyone has a phone, you know, um, healthcare needs to be more like B to B to C, in the sense that you want an experience where it's frictionless, right? There's a lot of things in healthcare that create friction. If anyone has had to have, whether it's a day surgery or just any type of procedure, even if it's like, as a female, your mammogram, like just all the hoops you have to go through just to get the mammogram appointment is insane. Um, so I wholeheartedly agree with you, and I love what your naturopath is doing. And like I said, I'm gonna go back to my comment that the digital passport that you could carry for your health and share with anyone that you choose to. And think about how critical that is. Like if you're going to the pharmacist can't say, "Oh, you shouldn't do that," or give you contraindications. They don't know everything that you're taking.
Yeah, so good. Like, yeah, I mean, the doctor's recommendation is only good as the last test they ran. But
Yep,
I get my
and
blood
that test is
tested.
just, yeah, it's just that point in time, right? So, you know, the, you know, as someone who used to be clinical, like I said, even that blood test is just for that point in time, right?
Right.
How frequently are you getting tested? And what other things have changed? Should you be getting tested more frequently? If you're giving information to your doctor about, like I heard you say about your nutrition, how you exercise, if there was a change, it's like, hey, we should probably get blood work done because of I'm seeing X, or whatever the case be, versus just waiting for your appointment. Wouldn't you feel better if you could just like go get the blood test, because it was like, hey, just go to the Quest or whatever, just show up. They're waiting for you. They'll do that test, and then you get a notification saying, "Hey, change your medication," or "Hey, there's a prescription waiting for you." Right? Like you want boutique service from your healthcare provider, just like you expect from, like in the consumerism world. Like if healthcare, I mean, if healthcare could be like the consumer world, like I said, I just think we'd be in a much better place.
Absolutely. Yeah. And then seeing those markers over history. A couple
Mm-hmm.
of tests that my naturopath has done is the full panel blood test. I mean, like everything. A
Mm-hmm.
lot of times when you go to your GP, they just test like, if you're on TRT, they just test
Mm-hmm.
estrogen and testosterone. But it doesn't actually cost that much more money to get like yeah, they pull a few more vials out when you go to take the test, but they've already stuck the needle in you. You might as well get it all out and get the full data. And that's what my naturopath does, is just gives me an absolute full panel of all the things. And then I do that about every quarter, every 6 months.
Mm-hmm.
That is so interesting, just to have my blood work over the last couple of years at that degree, and um, just see how things are moving. The other thing, maybe a little gross to talk about, is like the microbiome, the stool sample that
Mm-hmm.
tells you all your
Mm-hmm.
gut bacteria. Man, if you know what your blood looks like and you know what's coming out of you, you can make a lot of informed health decisions.
Yep,
Um,
like I said, the biome is I think underrated, like in Western medicine, right? It's starting to catch on, but your gut biome controls everything. It controls your brain. And this may gross some people out, but some people actually do fecal implants when they can't self-regulate their biome through just diet, right?
mm,
It is a thing that some people have literally had to have fecal implants because they're, for whatever reason, when they've had multiple courses of antibiotics or just lifestyle, etc., diet, that has
Interesting. So
harmed their
the
system.
probiotics don't actually get there. Things are too messed up for the probiotics to
Yep.
survive
So they literally
far
have
enough in.
yeah, they
Yeah,
replace
that's
it.
really cool. That's really
And
cool.
you
I didn't
think
even
about it,
know
if
that
you
that existed.
it does exist, and I will say that in the U.S., not as common. But once again, just because I keep up in healthcare, other countries have been doing this with great success because they know that the gut biome is so critically important. And of course, there are foods that you can eat naturally that help with your gut biome. And yes, you can take prebiotics and everything else, but the the quality of our food, even if you're being intentional how you eat, you still need to supplement because our soils are depleted, etc. We could spend a whole episode just talking about food as
Yeah.
medicine.
Yeah, for sure. You know, you're right on with my family. My wife is super into this stuff. Most of the things I'm saying I've learned from her. And just absolutely love this. And you're right, preventative health is just not in the repertoire, and we need to change that.
Yeah,
What do you,
and that's what the singular healthcare systems like a Canada or a UK or Europe are doing is they focus on that preventative and they also focus on the whole. So just like you're seeing a naturopath, they look at they treat the whole system, not just look at individual symptoms, which like I said, I think that it's the way Western medicine is taught, the way doctors are trained. So whether it's a naturopath or functional medicine, you will get a completely different experience.
well, cool. I have a couple of different questions to ask. What do you think I think we've already talked a lot about the largest gaps, but I just give you the opportunity to summarize. Like, what do you think either the largest gaps are or the biggest challenges to getting to your ambition or your, you know, kind of your vision or your ideal future?
Yeah, I think that the biggest challenge really is, regulations and because of dealing with patient health information and just being cognizant of cybersecurity and how we need to be so careful and have that governance. Like it needs to be very thoughtful. So the technology that you choose, the controls you have in place, and ultimately at the end of the day, anyone who's had a cybersecurity incident, it always starts, with training your employees. Everyone has to understand from all the different ways that you can be hacked. But for us, that's the biggest challenge. And then just keeping up with the regulations and making sure you're compliant. Um, you know, and trying to stay ahead. Like we deal with CMS on a quarterly basis, so we can kind of stay ahead on our roadmap and understand things that are coming that aren't necessarily public information yet. It's really crucial to our business. If we didn't know that, we maybe start down the wrong path because we didn't know something was coming. So having those relationships is super critical for our organization.
Yeah, that's well said. Um, how do you, how do you plan for the future? What are some ways that you're planning for the future and making sure that you have a proper roadmap?
Yeah. So first off, there's got to be executive alignment and that cross-functional collaboration in the team. And I always say customer success leads clues. So, even though we're doing that internal stuff, my job is to be out in the field, not just industry, but talking to our clients and listening to them and then giving them what they don't realize that they need to, right? And for the us, like we're delivering a platform because there's expertise aging out. They can't do it. Cost of labor is, really impacting margin. And we're creating this platform that they can do everything in. And every time we show it, people are like, I didn't know I needed this. And it's because we've been listening.
Yeah, that's so good. Well, what's a lesson that you've learned from failure?
Um, I think I think the biggest thing is I maybe look at this a little bit differently than most people because I have a science research background, but I never look at failure as long as I've learned something. So to me, failure is only if I did something but I didn't learn something from it. So I repeat it. So I always do postmortems. We do postmortems with our teams. We do postmortems with the executive team. And it's like, what are we not going to repeat again? Because to me, the definition of failure is, oh, it didn't work, but you repeated that same mistake. That's failure to me.
Yeah, love it. one of my good buddies, or Sydney Decker, right, wrote a couple of books, and he spoke at a couple of the DevOps conferences that I was at, and he would say, if if Charlie fat fingered the deployment and took the company down, would you fire Charlie? And some people raised their hand. Well, what if he did it twice? More people raised their hand. What if he did it 7 times? By about 7 times, everybody's raising their hand. And it's interesting. He'd say it's interesting that you guys would just get rid of Charlie, but not fix the system. And in
Mm-hmm.
healthcare, I think, that there are stories that are maybe a little older, hopefully they're older, where, medicines would be organized in the ER in alphabetical order, and something that could kill you was right next to something that could save your life. And then it
Mm-hmm.
was the ER nurse's fault for grabbing the wrong thing. It wasn't the system's fault for creating the possibility of failure.
Mm-hmm.
And so I think, yeah, if there's a failure and we resort to like blame or fault, and I really feel like fault is a fallacy. Like, we still have to take responsibility. Even if I get rear-ended in a car
Right.
accident, I might not be at fault, but I still have to take responsibility. That, like, oh, I got to call my insurance, and I got to take my car to the body shop, and I need to go get checked out at the hospital. Like, I'm still responsible for that event, even uh, how important is fault really?
Right. And like I said, I guess I should have added when we do that, post-mortem and what do we learn? And it's like, then what are we going to change, right? So it's an iterative process. And so that's why I never look at failure as being bad unless it's something that, you knew and you didn't take action on, right? That's failure that, you've repeated it.
I love that. I love that. Well, what ex- what would you tell people who are just starting either their healthcare career journey, or what advice would you give to the up and comer?
So, if you're starting in healthcare, I think that the biggest thing is just to go out and talk to a variety of people. Like I've been very fortunate to, speak to people on the clinical side, the finance side, and really understand the ecosystem of what healthcare is and what the journey that a patient takes. I think having that 360 view makes such a difference than just being siloed, like, oh, this is my role. No, I need to understand everything so I can really serve and add value.
Yeah, I love it. Well, if people like what you've had to share today, how should they connect with you?
LinkedIn is the best place to connect with me.
Awesome. We'll make sure that that gets into the show notes. Yeah,
Awesome.
I just really appreciate being here. Love this
Thank
conversation.
you.
And super
I know we
enjoyed
took some
having you on
segues,
the
but it was
pod.
awesome.
Yeah, thank you. Awesome.